My bra's good?
You're good
Okay.
to go. Good morning, Teresa. Do you give us permission to use this video for testimonial and educational purposes?
Yes.
Thank you. We'd like to ask you a few questions today. The first is, when did you start seeing Dr. Abbasi?
It was about April of last year, 2016.
Okay, perfect. What were your symptoms at that time that brought you to Dr. Abbasi?
I had pain, lower back pain, it kind of wrapped around my waist, but numbness and throbbing and numbness down my left leg.
Okay. And during that time, when was your surgery? About how long ago was that you
I
did the
had my
surgery?
surgery in November 22nd of 2016.
Okay. And how well did your surgery go for you?
Actually, really well. It was rough to begin with, but I feel about 60% improved since. The pain is much different. The nerve pain is still present, but I'm working on it. I feel much better. I feel the movement is better.
Okay, your daily life is much better than what it was prior to the surgery?
Yes.
Okay. So you're doing really well now compared to prior?
Absolutely.
Wonderful.
Absolutely.
And how have your symptoms improved as far as your daily activities and things that you weren't able to do and now can?
The pain isn't constant, as excruciating constant like it was before the surgery. I have quite a bit of nerve pain yet, but I'm working on that, and medication is helping that, and now I'm hopeful I'm going to be starting some physical therapy. I've been doing some exercises on my own, and he just says I'm his problem child in about 8 more months, but I'm feeling good. I'm wanting to get out of this contraption, the back brace, and get moving, and I'm feeling better. I'm feeling like I want to do stuff instead of just sitting around and not being able to do it.
Sure. So that's fabulous. So you definitely have progressed much further and you're doing well.
Yes,
Fabulous.
yeah, I feel good.
Is there anything else that you'd like to tell anyone in regards to your surgeries or any of your post-op recovery?
Well, I really appreciate Dr. Abbasi not rushing into surgery initially. You know, I started out, I had an epidural, did a round of physical therapy, hoping that would help, and then the lovely discogram. And that was kind of the telltale that, you know, and this has been going on. I've had back problems for several years, and it was kind of never pinpointed, and he kind of got on top of it, and just the care that I received during, you know, it was rough to start with, you know, getting back on my feet and moving, and because I really didn't have any use of my left leg afterwards. There was the nerve issues, but the follow-up and the care and information was key.
Perfect.
Information that I got prior and then during, and just getting any questions answered in that, and knowing that I'm going to be better. I already feel better. I guess I feel energized in comparison.
Oh, that's fabulous then. Well, that's wonderful. We like to hear that.
Yeah. I like to hear it.
Yes. So. Well, thank you very much for taking the time to give us your take on your surgeries, your pre-op and then your post-op care, and we appreciate that.
Okay, thank you.
Thank you.
All right.